Hello and welcome to lyra.me, and today we are going to talk about grapefruit seed extract, an amazing natural antibiotic that you might not have heard about despite all of its proven success and its capabilities that have been scientifically researched, as you will see in this presentation. And we're going to tell you everything you need to know about grapefruit seed extract and show you some of the conditions that you can successfully treat with this amazing natural antibiotic. So without further ado, let's dive right in and learn more about grapefruit seed extract. And I would like to start by talking about microbes and antibiotics. And today there is an increasing need to find botanically derived natural antimicrobial remedies to counteract the resurgence of infectious diseases and bug-resistant antibiotics. The new microbe strains that are more difficult to treat than their predecessors are, for example, methicillin-resistant Staphylococcus aureus, which is a major risk factor in fitness studios as well as hospitals, but also Clostridium difficile, mostly acquired in hospitals and causes severe gastrointestinal disorders, but also new E. coli strains that have appeared that are often delivered with our food and they can cause severe diarrhea. Also tuberculosis and respiratory conditions which are on the rise despite our antibiotics that we use nowadays. Lyme disease, which is one of the most drug-resistant conditions known nowadays, very difficult to treat, and other conditions that are difficult to treat, such as chronic fatigue syndrome, cytomegalovirus, AIDS, Epstein-Barr virus, herpes simplex, Candida albicans, Giardia, Entamoeba histolica, Blastocystis hominis, Cryptosporidium, and also very widespread and dangerous are microparasitical infections of the protozoa class nowadays. And our immune system also on top of that is also weakened due to the spread of steroidal and NSAID drugs and the high toxicity that we experience in our air, our water, our foods, which are infested with heavy metals, pesticides and toxins of all kinds. And that's why we need to look for alternatives. And one such alternative that has been discovered is grapefruit seed extract. Grapefruit seed extract is a substance, as the name already suggested, is derived from the grapefruit pulp, but also the white membrane and the seeds of the fruit. And it is highly effective as an antiseptic. It has also preservative properties with exceptional antifungal, antiviral and antibacterial properties as well, which is due to its polyphenol compounds such as quercetin, hesperidin, camphorol glycosides, naringine, apigenin, poncicrine, as well as retinoside. And the polyphenols are unstable, but during the manufacturing process the grapefruit seeds are converted into a more stable compound, which is known as quaternary ammonium products, or QUATS for short. GSE is also a great source of plant antioxidants, one of which includes hesperidin, which is a natural immune system stimulator. Grapefruit seed extract also contains vitamin C, sterols, tocopherols, citric acid, limonoids, as well as trace minerals. And when we compare GSE with other alternative antibiotics, such as colloidal silver or CDS, or even with bleach, GSE is evidently the superior antimicrobial remedy, and it's therefore the best disinfectant for your home, hospitals, etc. The extracted liquid is extremely bitter and acidic, however, therefore it is mixed with 50% vegetable glycerin to reduce its acidity and bitterness, and GSE in glycerin is safe to use and very active. GSE solution in glycerin mixed with silica becomes even more easy to consume. It has no bitter taste or acidity anymore. It can be encapsulated or tableted, and tableted is, by the way, the best way to consume it. And GSE has been successfully tested against Campylobacter jejuni, Chlamydia trachomatis, Entamoeba histolica, Giardia lamblia, herpes simplex, Helicobacter pylori, as well as influenza A2 viruses. So, how does GSE work? Well, to better understand this, let's quote some of the main doctors that have been involved in the research concerning grapefruit seed extract. Dr. Sung Hwan of Abcom Chemico states that considering all the electron micrographs, we believe that the microbial uptake of GSE alters the microbe's cell membrane by inhibiting the enzymatic activities, and you can see the loss of cytoplasmic membrane. Dr. Roger Wyatt, who is an associate professor at the University of Georgia, who has performed extensive research on GSE used as an organic disinfectant, was impressed by the lack of toxicity of GSE, and he said that extremely low concentration of GSE can be used with marked beneficial health results. The mystery about the antiviral action of GSE is not completely solved as of today, as the viruses do not actually have a cell membrane, but the researchers continue their research on the mechanisms of this miracle antimicrobial drug, and the positive results are undeniable already. What are the advantages of GSE over other antibiotics? Well, first of all, it has a very broad spectrum. It works against a wide range of microbes, bacteria, viruses, fungi, as well as protozoas. It's very effective. Laboratory studies have repeatedly shown that GSE is effective against dangerous germs, even when it is greatly diluted. So 200 to 2000 parts per million are required only to show its efficiency. It's also non-toxic. Acute toxicology studies performed by Northview Pacific Lab in 1995 reported that GSE is safe even at concentrations of 5,000 milligrams per kilo body weight. For a weight of 130 pounds, you would be safe at 300,000 milligrams per day, therefore a preposterously huge amount since the typical consumption is less than 1,000 milligrams per day. It has also minimal negative impact on beneficial bacteria. So contrary to other antibiotics that we use, it does not kill the good bacteria within your system. GSE may actually assist the growth of beneficial bacteria by inhibiting the pathogenic strains even. It's also hypoallergenic, so for many years the major death cause of prescribed drugs was the so-called anaphylactic shock. And GSE, even if taken on a regular basis, does not produce such an allergic reaction. It's biodegradable as well, so bioresearch laboratories of Redmond, Washington confirmed the biodegradability of GSE, for example. It's compatible with many other natural remedies. Over 75 different herbal combinations that contain GSE are available, and GSE either retains or even enhances the other herbs' potency. It's very affordable also when compared with prescripted antibiotics. You end up with 30 to 50 US dollars per month only for your GSE therapy, which is very affordable, of course. And it is a product that is 100% natural. It's derived 100% from natural sources. Next, let's go over some common conditions that have been successfully treated in clinical research and studies with GSE. First up, arthritis. Researchers have long postulated that the root cause for arthritis and rheumatoid arthritis are bacteria, also fungi, and parasitic infections such as Proteus vulgaris, Klebsiella, pneumonia, protozoa, and all are frequently found in the GI tract of arthritis patients. And our immune system produces antibodies to neutralize the antigens that are spread by the microbes, and these antibody-antigen complexes are absorbed by the intestinal lining and enter the bloodstream. Usually our body handles this through our liver, our kidneys and lymph detoxification processes, but this may trigger serious complications. For example, with Klebsiella, this reaction occurs in the spinal column, and a debilitating condition known as ankylosing spondylitis may cause vertebral segments to fuse together, and thus you lose your spinal flexibility. Different inflammatory responses with Proteus vulgaris occur in the joints, resulting in swelling, deformities, as well as pain. What is the GSE treatment for arthritis? 3 to 5 drops of concentrated liquid mixed in juice, because it's bitter, of course, 3 to 5 times per day between your meals for 8 to 24 weeks. And you should also take a probiotic during the GSE therapy, and you will see great results. Another common condition that can be treated with GSE really well is chronic fatigue syndrome. It's one of the most puzzling and devastating conditions, and recent studies have shown that it is caused by a number of microbial, biochemical, as well as nutritional factors that are disorganizing your immune system. Chronic exhaustion, aching muscles, depression, sleep disorders, allergy, susceptibility to infections, all very similar symptoms to Lyme or AIDS, and many times doctors prescribe antibiotics, which actually even further weaken the immune system. GSE therapy can help you as well. CFS patients experience many times burning sensation in their diaphragm and upper stomach, and therefore they must use GSE powder or capsules because this is better tolerated than liquid concentrate. And you start with 1 capsule per day and gradually increase the quantity to 4 to 6 capsules per day, and you take each capsule with at least 16 ounces of water. But wait, there is more you can treat with GSE. Diarrhea, for example. Diarrhea has a variety of causes, most of which are of microbial, viral or fungal origin. Parasitic dysentery is caused by Giardia, amoeba, and this may require months of treatment with GSE or vivid artemisinin to cure. And GSE therapy for diarrhea is you use 15 to 20 drops of GSE concentrate or 2 capsules every 4 hours for 4 to 6 weeks. And you continue the GSE therapy with reduced quantities for the next 2 to 4 months to avoid a recurrence of the condition. For parasite-induced dysentery, you must add to this GSE protocol vivid artemisinin with 25 milliliters per day for 6 weeks, and also take probiotics during this treatment. And you can treat like this nausea, also vomiting, excessive flatulence and bulging, ulcers, as well as stomach and duodenal cancer. It also treats skin eczema that is associated with gastrointestinal infections, so rashes. And by the way, vivid artemisinin, which is a unique preparation of the Artemisia plant, can be exclusively obtained at lyranara.me, link in the description box below. We can also treat Candida with GSE. Candida albicans is one of the greatest health challenges to people that are living in industrialized nations nowadays. Candida is an opportunistic pathogen that is present in your gastrointestinal as well as urogenital tract, and when the yeast begins to grow, so do its toxins, and the people begin to suffer with symptoms such as fatigue, indigestion, flatulence, constipations, diarrhea, depression, anxiety, carb cravings, frequent bladder infections, ear infections, skin eczemas, and many other symptoms. And GSE is one of the best remedies against Candida. When you treat Candida with GSE, we recommend to have a special diet to reduce or avoid a Herxheimer reaction, and this diet must be based on a high fiber, low starch, vegetable diet with 20% maximum in proteins, so fish and nuts, and 10% complex carbs such as rice, millet, amaranth, quinoa, buckwheat, as well as 5% fruits, so papaya, pineapple, berries, and grapefruits. Also, we recommend that you consume 6 to 8 caps of the high-potency probiotic. Garlic also works, and aloe vera for the detox process. And the GSE therapy itself goes as follows. For day 1 to 3, 10 drops of concentrate, 50% concentrate to be more precise, twice daily after dilution, or twice 125 milligram caps, also daily. For days 4 to 10, 15 drops twice daily. For days 11 to 28, 15 drops 3 times daily, or 2 caps 3 times daily. And this dosage was calculated for 150 pounds of weight. So depending on your weight, this might vary. Chronic candida may be treated during 6 months, and you can also treat toenail fungus, athlete foot, and other kinds of fungal infections this way. One of the other infections that you can treat really well with GSE is urinary infections. And antibiotic-resistant urinary tract infections are increasingly common nowadays, which leaves many people looking for natural alternatives, of course. And such a great alternative is GSE. Urinary tract infections are a common nuisance, disproportionately afflicting women, most of who will have urinary tract infection at some point in their lives. Urinary tract infections, when left untreated or when conventional treatments with antibiotics fail, can progress to more serious kidney infections, and the most popular antibiotics used by urologists are Bactrim, Cipro, and MICROBES. Antibiotics are also of great concern for pregnant women, as the changes in the prostaglandins and cytokines they can contribute to the preterm delivery. GSE is believed to help alleviate the symptoms of these urinary tract infections, which can result in painful, frequent urination and blood even in the urine. And urinary tract infections are caused by different bacteria, but they all secrete a protein called urease. And this is why your doctor will diagnose you by a urine dipstick, which detects the urease in your urine. And urease is the compound that we believe allows the bacteria to stick to the cells in your kidney and cause an infection. So if you can inhibit or stop urease production, you can stop these types of infections. Among other natural remedies such as cayenne pepper, cranberry juice, dimanose, uva ursi, oregano EO, GSE is one of the best and is highly recommended for urinary tract infections, especially in case of E. coli infections. The GSE therapy is very simple again. You take it in powder form, 1 teaspoon full every 2 hours with plenty of water, and keep that same dosage regimen up until you have become free of any symptoms for at least 5 days. And once you reach that point, you continue to take the GSE, but every 4 to 6 hours for another 5 days. And you slowly cut back to twice a day for another 5 days, and finally you continue taking a small dose, say quarter teaspoonful every day, just to prevent a recurrence for at least 1 to 2 months after that. So there you have it, grapefruit seed extract, one of the great discoveries of our time. And all over the world, GSE is used already for killing a wide variety of bacteria such as Salmonella, E. coli, staph, as well as strep germs, viruses, herpes, parasites, and fungi, including Candida. And there have been many studies performed on GSE, and they've been comparing, for example, its effectiveness against other substances such as chlorine bleach, isopropyl alcohol, as well as colloidal silver. And GSE has always come out on top. It's far superior as an antimicrobial drug than any of these other substances. It is also great as a purifier, antiseptic, as well as a preservative. It is effective against more than 800 bacterial and viral strains, 100 strains of fungi, as well as a large number of single-cell and multi-cell parasites. It has also been proven to be effective against food poisoning and diarrhea, as we have discussed. And many professionals, such as doctors, veterinarians, farmers and consumers, praise its value and effectiveness. GSE is literally one of the botanical wonders or natural antibiotics that we know of today. It also has no toxicity, shows no relevant side effects or health contraindications, creates no drug resistance, and its efficacy has been demonstrated many times over for a wide spectrum of bacterial, viral, parasitical, as well as fungal infections. And the examples of the therapies that we have presented to you in this video do not exhaust by any means the potential of this wonderful natural product. It is more effective than nystatin, the classic pharmaceutical drug that is used in Candida therapy. It's more efficient than metronidazole, also known as Flagyl, that is used normally in treating protozoa intestinal infections. And there are some renowned physicians that are treating many infections with GSE already, such as Dr. Leo Gallen, Dr. Jeffrey Band, Dr. Warren Levin, Dr. Alan Sachs, and those people are the absolute authority on GSE treatments. So if you need more information, read their papers on their successes with GSE. And with that being said, I hope that you've enjoyed this information. If you did so, please do not forget to like, share and subscribe. If you have any questions, shoot us an email at shop@lyranara.com or the contact information that I'm going to post as always in the description box below. We would also love to introduce a weekly Q&A session, so you can also drop us your questions in the comment section below, and we will pick the most interesting ones and answer them in a weekly Q&A session together with other questions from other videos. So please participate. This is not only about us presenting you some facts, this is about an interaction between you and us. And with all that being said, I hope that you stay and remain healthy.